And what it makes worse is the extraordinary lack of safety testing, and that you demonstrated remarkably in your book. There are several examples, but could you tell us the story of Prevenar? I think it's an extraordinary story. I could not
Sure.
believe it when I first read it years ago. You know, they had this gigantic clinical trial in California at the end of the 90s involving 20,000 children, which is great, with 1 year follow-up, which is better than usual. But what did they do? How did they compare the Prevenar? They compared it to an unlicensed vaccine. Is it possible?
Well, because unfortunately, it's not that different than many other vaccines, and I think you're right. It is a good story. So Prevnar 7, this was the first pneumococcal vaccine licensed in the United States. And so in its clinical trial, you would assume that you would compare Prevnar 7 against an inert substance, a control group that got like a saline injection. This way, you randomize them, you blind the researchers, you follow them for a few years, and because you're giving this to 2-month, 4-month, 6-month-old babies. So obviously you want to follow them for at least a few years. Otherwise, how do you know the rates of developmental issues, neurological issues, immunological issues? And then after a few years, you unblind everybody and you compare those that got the vaccine with those that got the placebo. And you see what is the difference in cardiovascular outcomes, immunological outcomes, neurological. You compare it all, right? Like they do with most drug trials, multi-year placebo-controlled trials. Except here, they didn't do that. First, they licensed Prevnar in a clinical trial that compared it against another experimental vaccine. That alone rendered the trial completely unethical and inappropriate basis to license this vaccine, because the adverse event rates in both groups, though they were similar, that doesn't mean it's safe. That just means both products could have caused the same amount of harm. Second, they didn't review it for long enough. It was 30 days and 60 days for certain conditions. That's it. This is a product given to babies. You're not going to know much after 30 or 60 days on the actual health effects. And finally, it didn't actually have enough in children to validate that the benefits outweigh the risks based on the rate of pneumococcal concerns. Like, what are the potential harms from pneumococcal? That's how you should dictate how powered it should be, how many kids. So it failed on all three scores. It was a useless trial to affirm safety. But yet, then when Prevnar 13 was coming to be licensed, it was compared against Prevnar 7 as the control. So then they did a clinical trial to license Prevnar 13 by using Prevnar 7 as the control. That trial actually looked at safety for 6 months finally, which, by the way, in contrast to most childhood vaccine trials, is a long time. Most of them are days or weeks of safety review after injection. So here you go. You gave the shot Prevnar 7 and 13 to healthy babies, and after 6 months, they found that about 7% of the children in the Prevnar 7 group had a serious adverse event, and about 8-something% in the Prevnar 13 group had a serious adverse event. A serious adverse event is something very serious. Okay, it's death, hospitalization, surgery. It's really bad. It's not normal for 7 or 8% of healthy babies to have a serious adverse event within 6 months. That clinical trial should have raised alarm bells. They should have said, whoa, we got a problem. But since that's not how the FDA approaches licensure, they approach it technically. And technically, it met the standard for licensure. Why? Because the rate of harm was similar, 7, 8%. They were close enough. They were not statistically significant, apparently. And so it could be licensed. And even the explanation given by Pfizer for why they could have been higher is, well, we actually reviewed safety for longer than most clinical trials for vaccines. That's not an excuse. That's an indictment. Then they used Prevnar 13 as the control to license Prevnar basically 15 and 20, not Prevnar 15, excuse me, a pneumococcal 15 vaccine by another company, as well as essentially Prevnar 20 or another pneumococcal 20 And in those trials, the serious adverse event rate or the harm rate went higher for the newer version. So you keep having these increasing rates of serious adverse events as you go from Prevnar 7 to 13, 13 to 15, 15 to a 20 valent, but yet it's deemed safe all along the way. But underlying that entire pyramid scheme is a completely defective clinical trial. And the reason that Pfizer is not concerned about doing this is because they're not going to be liable for claims that they could have made this product safer, and by failing to do so, kids got injured or killed. Pfizer would not do this with a drug, I don't think.
Yeah. And they managed to license the other vaccine, the comparator, the experimental vaccines, with that same trial in England and France. It was meningitic, and so it's and there was twice as much SIDS death, infant death in the comparator than in the Prevnar group, but it's not statistically significant, so it's okay. They can license it.